Hmm. Uh, have you seen any different in your mouth, like for example wo- wood?
I
Do
don't.
you, have you seen any different in your mouth?
Well, I don't think there is any any difference in my mouth.
So, um, do you feel pain when you eating?
No, I don't have any differences in eating.
So just only pain in your mouth?
Yes, it's a little pain.
Okay. Have you lose your weight?
No. Yeah.
Have you lose your appetite?
No.
Have you have any fever?
Recently, I think no.
So you just only have two symptoms: is feel quick and feel and have pain in your mouth. Only two symptoms.
Well, yeah. I think I feel weak. Before 6 months ago, when I was stood at my class. I was standing in my class, and I feel a little bit tired. It just come really unexpectedly when I stand up. I never felt this before. Yeah, but it's happened more usual. Before that, I was quite healthy. I'm able to walk, do my housework and walk around my house. But I'm unable to do it before the first time. Every time I have to do something, I have to take a short break, and I was able to continue doing what I want to do.
Okay. And when did you feel pain in your mouth?
I don't remember exactly. Maybe after the first symptoms.
Do you have any bleeding in your body? Bleeding?
No.
Do you use any drug before?
Well, currently, yes. I use amlodipine about 10 milligrams, 1 pill a day.
Can you repeat the name of the drug?
Amlodipine.
Amlodipine.
Yeah.
Why have you have to use this drug?
I was diagnosed with hypertension.
Hypertension?
Yeah.
Any other medication history?
Well, I think no.
No, only yeah.
I don't get it. What do you mean, history? Blah.
I mean, do you have any? Do you did you diagnosed with other disease besides hypertension?
No. If my memory serves me well.
So the maximum of your blood pressure or what Um,
Let me see. I don't remember exactly because I have a daughter and she's like doing it for me every morning, and she just said that she is the one who do it, not me. So I'm not really remember it, but it's like around the maximum is around like 150 and maybe like 100.
um, have you usually go to the family doctor to change the dose of your medication?
No, I don't. Just I use this for quite.
You mean that you use the dose of amlodipine for a couple of months, but you didn't go to the doctor to ask them about your blood pressure to change the dose?
No, the doctor said I have to check my blood pressures like regularly. But if anything, if my blood pressures like go into high, then I need to go to see them. But I don't think there's much problem with my blood pressure.
I think I will give you some tests in blood to find out your problem.
Doctors, can I answer some questions?
Yes.
It's about a family issue. My dad and my mom, both of them was passed away because of cancer, and I searched my my symptom on the internet, and I had found many results that told me that maybe it can be a cancer, because it's running the cancer is running in the family. So I was afraid that if there's something happened to me, and maybe it's
What cancer did they have?
My dad his was disease colon disease, colon cancer.
Just start with the another
Okay.
doctor. Yeah, go ahead. Keep asking.
Yes. I'm sorry. Can you can we continue? Yeah. What cancer did they have?
My dad disease because of colon cancer.
Okay.
My mom was my mom. I don't remember. It's like leukemia.
Yes. Yes, I know some a small not the heritage of the cancer is not mean that if your parents have cancer, you will have cancer. It's just a small number of a small percentage of people will heritage the cancer. So you don't need to worry about it, because I saw that you just have fatigue and pain in your mouth, and you don't lose your appetite or lose weight or fever. I think it's if you too worry, maybe I will give you some tests in colons for you feel more.
I'm sorry, doctor, but I see that you have two friends with you, Dr. Lam and Dr. Tao, if I'm not wrong. But they don't seem to do anything. So if you mind, you can ask them to join with you.
Yes, I don't know how to invite them to join.
Hello. Uh, yeah. My name is Thảo, and due to the internet connection, I just I only can listen a little bit about your conversation with the patient. So if now um, if I could start, can I start again because there are many information that I misheard.
You can. You are free to posing questions for me. So please.
Hi, Chris. I am Thảo, your doctor today, and I really want to ask you some question. I heard that you came to the hospital due to you felt weak all the time, right?
Yes.
Yeah. So when did it start? How long did this happen?
Yes, it first happened like 6 months ago. It started suddenly when I was working in my school.
And it just happened suddenly.
Yes, it happened like unexpectedly when I was sitting in my chair, and when I stood up, I just feel really tired, and I never have this problem before.
Since that time until from that time to now, you always feel weak. Do you you know that can you walk or can you do that daily housework by yourself, or you have to have any assistance from other people?
Yes. Whenever I feel tired, it's very bad. I feel disease, and yes, I cannot walk properly.
And did it relieve when you take a rest for about 30 minutes or something?
Yes, I feel much better after about 10 or 15 minutes rest.
Yeah. And and you also said that you feel pain in your mouth, right? When did it start?
I don't remember exactly. I'm sorry. Yes, I'm too old to remember.
So it happened before you feel tired or after you feel tired?
I think after I feel tired.
Okay. And it like a sharp pain or dull pain? Dull pain.
I don't think that is a sharp pain. Just like very slightly.
And did it abbreviated when you eat, or you just feel it time and then?
It's just it's not that much pain, and it's don't interrupt eating with my eating or my working. Yeah. Sometimes I just forgot about it.
Okay. So did it radiate to somewhere, like it go down to your stomach or anything else?
Just happen. It's just around my mouth and going nowhere.
Okay. And do you have any symptom like when you feel so tired, your heart rate is raised, and you feel short need of breath?
No, I don't think so.
So can I sum up your illness and that you feel tired all the time, and then you have pain in your mouth, which is a dull pain, and did not radiate to anywhere.
Yeah.
And do not feel and your heart rate is normal, and you do not have a shortness of breath. You eat normally. I
Yes.
mean,
I think I'm. This is. I thought that I told you before that was okay when I'm eating.
yeah. And what about your bowel movement? Do you have diarrhea or constipation, or it's you can pass the figures normally?
Sorry, can you repeat? The signal is not really well.
I asked that. What about your bowel movement? Do you have diarrhea or constipation, or you can pass the figures normally? Feces, sorry, pass the feces normally.
Yes. I think my body is fine. It's just tired.
And okay, now I have some question for your some other question for the medical history. You have hypertension, and now you using amlodipine 10 milligram per day, right?
Yes.
Do you have any are you allergic with something like peanut butter or
No.
some medication?
I don't think that I have problem with any type of food, but I think when I was younger, when I drink, like when I take penicillin, I have a rash. So yeah.
Have you had any surgery before?
No, I have never have it before.
And have you had to hospitalize before?
No.
Okay. So about your family, your father was died of colon cancer, and your mother was died of leukemia, right?
Yes.
And do you have any sibling?
No, I'm the only child.
And do you have any children?
Yes, I tied a knot 20 years ago and have a beautiful daughter.
So now, is she healthy?
Yes, until now she is totally healthy.
And do you alcohol?
No.
Do you smoke?
Yes, I smoke 2 packs a day.
And how many years? How many years do you smoke?
Yeah, I think it's about 20 years.
Okay. And do you caffeine like coffee?
Yes, but not regularly, just sometimes.
So recently, do you have any, or have any depression, or bad thing happen with your life?
No. Yeah, I could say so.
Okay, thank you. I would continue my work, and thank you for your help.
Thank you, doctor.
Sorry, I could not, continue my my performance because I cannot think to any diagnosis. So, could anyone help me, please?
Dr. Chang's, I think you can continue.
Yes, I want to talk more about you said that 6 months ago you suddenly feel tired. when you're working in your school and you feel tired when you sitting and stand up. So is this symptom last in 6 months?
Yes.
And did you eat normally? I
Yes.
mean, enough food?
Yes, I just eat like
Normal. Do you feel any chest pain?
I think no.
So how about your merchant? I mean that how about your period? Menstruate.
I think it ended up like 20 years ago.
20 years ago, but I mean, do you have a period normally? I mean, per month, once per month.
Yes, but before when I was younger, yes, it's normal.
Yeah. But now
I'm more than 6.
yeah, sorry.
I don't think I have period.
Yes, okay. I also, yes, I don't have any questions.
Okay, good. Thank you. I think it's also time's up. So Thương, you can bring everyone out.
Yeah, I bring everyone.
Everyone's already out.
It needs 45 minutes. Sorry, 45 seconds to let everyone come out.
Okay. Just I don't know if people know like to click the leave the breakout room or leave the meeting.
I thought so many rooms they're very like dedicated in asking, talking, and answer. But they
That's
didn't
good.
come. Yeah.
The main room is really good too.
Yes.
I didn't see Thanh Lam ask any question, but
Yeah, still have one member. He is real me C50. Can you change your name because like it's better for us to call you or come for communication as well.
next time if everyone in the room with like a lot of people, maybe you guys should discuss among yourself like how do we split up the history and ask everyone else. Maybe someone will ask something that you didn't recognize, who knows. One funny thing that I noticed is some of you look really like my preceptor. In fact, he looked really like my preceptor. I have a teacher, his name is Dr. Gasper. And it's like when Fact come in, I thought, oh, what's Dr. Gasper doing here? I was like, my teacher is doing something here. Well, just for fun. No offense, Fact.
My pleasure.
Hey, you guys, how you feel when we moved you into the room? What do you feel after that? Did you need CPR? You want to do CPR for resuscitation? No.
Yes, I just want to.
Go ahead.
Yeah, I just want to give a big shout out to my 2 wonderful doctors. They are really attentive. They really listen to my complaints. I was rambling about like my symptoms and like how like life is not fair to me, and they would like listen and like continue to cheer me up and like trying to find out what is wrong with me. So, yeah, they do like excellent.
Yeah, excellent. So who's the doctor? Mr. Ang?
Me, that was me.
Wow, that's
So,
good.
thank you, Mr. Am.
How
Thank you
is
so
the
much.
other rooms?
Also, Dr. Viet.
Good.
You make us proud.